Hi, I'm Enchanting Nubianette. Welcome back. And if you're new to my channel, welcome. I have a story for you that's going to blow your socks off. Let me paint the picture for you, YouTube family. Maurice White, an African American elder, and he was also a resident at the Parham Healthcare and Rehabilitation Center in Henrico County, Virginia. He was admitted in March of this year after undergoing foot surgery. So, as you and I would think and expect, he did also. He expected to be healing, receiving care, and basic human decency. But what he got instead was a nightmare that no one, and I mean no one, should ever experience. On July 11th, Maurice started feeling a sharp pain in his foot. I believe it was a right foot, but it wasn't a usual post-op soreness, but it was even something deeper. Something was definitely wrong. 3 days later, a nurse came to change his bandages, and she was so shocked she had a jump scare by just he was so concerned when he saw how she reacted to his foot. What she found, everyone, was maggots crawling out of his wound. Maurice described it as looking at a full cup of like elbow macaroni miniatures dropped on the floor. In quotes. Let that sit for a second, everyone. Now, this wasn't just a medical oversight, it was a full blown infestation, gnat larvae. It was documented in the facility's own medical records. And there was blood dripping, larvae falling out of his wound. So he was traumatized. Maurice said he hasn't even slept since. He even said he can't eat rice, spaghetti, or anything that reminds him of what he saw. And honestly, YouTube family, who could blame him? Oh my goodness. Now let's talk about what went wrong. So this is more than just one man's story. This is a systematic failure. Maurice's wound care was supposed to happen 3 times a week. But he says that there were days it didn't happen at all. No one came in to check him. No one, even though he's a man who is an elderly, even though he wasn't able to do anything himself as far as to dress the wound, to check to see how it was healing or anything, no one. And that facility, it has already been flagged. And in April, there was an inspection for pest problems there. When I say pests, I mean roaches, ants, gnats, and even a broken cooling system that hadn't been fixed since 2023. So we're talking about neglected wound care, poor sanitation, inadequate climate control, and of course, documented pest infections. And that's just negligence. Let's talk now about the violation of basic human rights. Maurice has paid to be there. His insurance is paying for him to be there. So this is why it matters, especially for all of us. Let's be real. Like African American elders, first of all, elders all across the board, doesn't matter what culture, what race you're from, all elders need to have extremely special care. But as we know, unfortunately, a lot of Black elders are disproportionately placed in underfunded, understaffed nursing homes. And when the systems fail, it's the same elderly people who suffer the first and the worst. So Maurice's story is a reminder that we need to advocate for our parents, grandparents, and eventually ourselves, especially in this economy. We know how the inflation is sky high. And many people who are even working are finding it so hard to make ends meet. We're living in an age, as you know, many people have lost their homes. They cannot afford rent. They are living in their vehicles, or they're even living in the storage units. And it's even hard to have the basics such as food. Let's continue. So, everyone, this is about accountability, adult protective services, and Henrico police are now investigating. But we need a lot more investigations. We definitely need justice because, this rehabilitation center has a long list of many complaints, and it sounds like, well, the point is nothing has been done. We need more transparency. Families deserve to know what is happening behind closed doors. And that's why I'm so adamant as far as reading reviews, going to different websites and comparing and contrasting to find out what is the real deal behind all businesses, whether it's a restaurant, whether it's a repair shop, what have you, and especially when it comes to healthcare. And policy changes need to be in place. Facilities like Parham Healthcare, according to, these allegations, everyone, they must be held to higher standards. So, what is it that we can even do, especially if you have loved ones in long term care? You definitely need to stay proactive. That's the first thing. So, what that means is visit often, ask the staffers direct questions, find out the names of who is treating your loved ones, you know, build rapport with them, go there and, stay for a while. I would stay honestly minimum 1 hour, but definitely stay even longer if you can. Ask questions about the hygiene, the wound care. What is the procedures being done? What are the medications that your loved one or is getting? Document everything. If you need to, take photos. Behind when the staff leaves, and most times they're often busy and doing other things anyway. You have a lot of time to do your own investigation. Take photos each time you go on a visit. Write down the dates, record details about what is happening, and also the names of the person who is working on that staff, the manager or director of the healthcare facility, and especially the staff who is one on one or just caring for your loved one. Report concerns to the Adult Protective Services, or go even higher. Go to the state health department, email them, go on to chats with them, and also start looking into communities where you can voice what is happening. Build a network, especially if your loved one is there for long term. And definitely push for reform in your local community. And go even further. Attend town halls if you have them in your community as well. And write down your representatives again. Know who they are, what they stand for, and build a rapport. And, even if you have to volunteer perhaps, in order to get close relationships with them. But you need to make sure that you have people who can advocate for you and who have a large voice and can actually get changes done. Because silence is being complicit. You don't want that. And definitely, when I heard this story, everyone, I said Maurice White's story deserves to be heard. It's definitely not just a tragedy, but we need to have change. And this is what I'm going to say last but not least. And Maurice White said it best. He said in quotes, "It's not fit for man or animal." End of quotes. And he's right. We can't let this be another headline that just fades away. We need to amplify. We need to advocate and act. Be progressive, be proactive, because dignity in healthcare isn't optional. It's a human right. So everyone, what do you think about this case? And have you seen the video of Maurice White and the hurt that you see in his eyes when he's telling his story, his experience at this facility? It's a shame here in 2025 for anyone to be experiencing this. Doesn't matter how much money you have. Everyone deserves to be treated with respect and to have the care that they went into the facility for. You know, it's a shame. And again, we need to make sure these changes take place because we're all getting older. And, you know, you never know when you may, get into a situation yourself or maybe a loved one where you need to have care from someone else because you're not independent anymore. So, in regards to the allegations of Parham Healthcare and Rehabilitation Center right there in Virginia, change needs to happen, and change needs to happen soon. So, everyone, thank you for watching. Please remember to like, share. Definitely please share this story. Reach out to others so people can get a heads up about this facility and even others. And definitely please subscribe to my channel. Thanks a million. Stay safe wherever you are and keep your head on a swivel.
Maurice White does not hold back criticizing his living conditions.
It's not fit for man or animal.
He's been a resident at Parham Healthcare and Rehabilitation Center in Henrico since he was admitted after a foot surgery in March. But he says his dissatisfaction with the facility escalated back on July 11th.
Got a pain in my foot, which I haven't had even after the surgery. I was like, it was a sharp pain. And I was like, oh my God, it's hurting.
3 days later, when he says a nurse came by to perform wound care, he recalls a disturbing discovery.
And when they cut the bandages off, I seen the young lady when she jumped. I said, what's wrong? She said, oh my God. I said, what? She said, they're maggots.
According to medical records from that day provided by White, staff wrote, while unwrapping dressing from left leg, they observed blood dripping from the left heel, and as soon as the last part of the bandage was removed, gnat larva was observed falling out of the wound bed.
My foot was infestation. Maggots was just coming out of both wounds.
Medical notes indicate staff cleaned the wound and then encouraged White to go to the emergency room. They say at first he refused, but later agreed to be transported. White tells me when he got to the hospital, the doctor was troubled.
He said, no, this is not acceptable, and he said he was calling Adult Protective Services.
Adult Protective Services would later reach out to Henrico Police, and they say the case has been assigned to a detective. Both HPD and Commonwealth's Attorney Shannon Taylor tell me they have open investigations. White says he is now receiving daily wound care, but he alleges there were some days prior to the incident where it did not occur as scheduled. His medical notes from July 14th, a Monday, indicate that wound care was done per order, and on Friday, no larva was present. White believes the presence of bugs in the facility,
flies, gnats, it don't make no sense. Roaches this big,
along with inadequate air conditioning, may have contributed to the incident. A state inspection in April described multiple complaints of pests in the building and a chiller that was not functioning properly. A corrective action plan noted that Parham was making repairs to the cooling system and contracting pest control services. Regarding White's concerns, facility spokesperson Mindy Barnett tells CBS 6, our community and every caregiver have dedicated ourselves to providing high-quality care and services. We actively solicit complaints so we may address issues which arise. We appreciate positive and negative comments and are fully investigating and addressing the concerns raised. Parham has a 1 out of 5 star overall quality rating, with staffing levels reported to be much below average, according to Medicare. While a sign outside the building indicates an association with the Medical Facilities of America chain, Barnett says it is independently owned and operated.
It's terrible, Mr. Lane, and something needs to be done about it. They really need to set it down. These people here, and I'm not speaking just for myself, I'm speaking for those who can't speak for themselves, they really need to relocate them to a proper facility.